5 million people every year. Not from a war, not from a new virus, from bacteria. But these aren't just any bacteria, they're superbugs. Microscopic bacteria that over time, with evolution, have learned to resist our best medicines. And the scary part is, they're winning. Despite the cool name, these bacteria are the result of evolutionary resistant bacterial strains that medicine has no effect on. Initially, medicine was effective against these superbugs. But today's video isn't about a doomsday story scenario. It's actually a comeback story. Right now, science is stepping into the fight, and the next chapter starts with artificial intelligence. At the head of this fight is a team of brilliant minds at the Massachusetts Institute of Technology, MIT, led by Professors James Collins and Regina Barzilay. They believe that AI could initiate a second golden age of antibiotic discovery, a new era where we don't just find drugs, but actually invent them. These are drugs not discovered, but created atom by atom by a machine. So how did they do it? Well, it wasn't a simple task, that's for sure. The scientists first taught the AI what a good antibiotic looked like. They fed it chemical structures of thousands of known compounds along with data on how well they inhibited bacterial growth. This process trained a deep learning model to understand the intricate relationships between a molecular structure and its effect on the bacteria. With this new knowledge, the AI was given a huge task: to explore a chemical space so vast it was previously inaccessible to human researchers. It interrogated a massive virtual library of 36 million compounds, including many that don't even exist yet. The goal was to find a needle in a haystack, or to put it more accurately, to design a needle from scratch that no one had ever seen before. The AI used two distinct powerful algorithms for design. First, a fragment-based method called FVAE, a fragment-based variational autoencoder. For the sexually transmitted infection Neisseria gonorrhea, which is rapidly developing resistance to current drugs, the AI began with a single starting point, just a small chemical fragment. It then searched through millions of other chemical fragments and built from there, kind of like a molecular Lego set. Researchers also used a different approach: chemically reasonable mutations, or CREMs. For the deadly superbug MRSA, or methicillin-resistant Staphylococcus aureus, the AI was basically given creative control. It had no starting fragments and designed entirely new molecules from the ground up. We should also consider that the team built in filters or guide rails to guide the AI's creativity. The system was programmed to discard anything too similar to current antibiotics, basically ensuring that anything it made would be completely new and never seen before. The results were nothing short of a breakthrough. From its millions of designs, the AI identified two leading candidates, two new drugs that can actually be used. Once synthesized in the lab, these compounds were tested in real life on bacteria in petri dishes and on infected mice. The first drug, NG1, a new potential drug effective in killing gonorrhea. And DN1, this compound was able to clear skin infection caused by MRSA in mice. But here's the crazy part that I want to hone in on. These compounds are structurally different from any existing antibiotics. They're not modified or old drugs. They're entirely new chemical classes that work using novel, never-seen-before mechanisms. For example, NG1 appears to interact with a protein called LPTA, a key part of the bacterial outer membrane synthesis. This is a mechanism that bacteria haven't encountered before, meaning that it could be much harder for them to develop a resistance to. While this is a huge step forward, the fight against bacteria, especially superbug-resistant ones, is far from over. As lead researcher Professor James Collins puts it, these drugs aren't ready to be prescribed tomorrow. They still face three significant hurdles. First, of course, time. Despite AI drastically speeding up the initial development, these drugs still require years of refinement. These compounds require 1 or 2 years of further optimization and refinement before they can even begin the long, expensive process of clinical trials. Which brings us to obstacle number 2, process of clinical trials. The process of testing for safety and efficiency in humans is lengthy and costly with no guarantee of success. Number 3, scientists also need even more advanced AI to predict not just how the drug will work on a petri dish, but how it will perform inside the complex environment of a human body. Despite these challenges, the outlook is optimistic. This isn't just a scientific achievement, it's a strategic move in our global war against superbugs. This work shows the immense power of AI in not just augmenting but transforming our approach towards medicine, giving us a huge advantage in this critical battle for human health. So that's today's video. If you found it interesting, make sure you hit the like button, subscribe so you know when I make a new video, and comment things you learned today or research that you might have found that you find interesting. I'll see you in the next one.